Eye twitching, and what we should really call eyelid twitching, is very common and a very common concern. And I find people are often looking for reasons as to why this is happening. So let's take a holistic approach and discuss the many reasons why. Why is my eye twitching? Well, not my eye, but it's a very common problem. Hey everybody, welcome back to Dr. Ashley, your go-to channel for everyday holistic health tips for the times we live in, also known as eco-medicine. Consider hitting the subscribe button to stay updated on the latest health tips. Eye twitching, and what we should really call eyelid twitching, is very common and a very common concern. And I find people are often looking for reasons as to why this is happening. So let's take a holistic approach and discuss the many reasons why. Finding an answer might help you to prevent it in the future. And by the way, if you have eyelid twitching that isn't stopping or persisting and then expanding to your whole face or side of the face, you should see an eye doctor so that it doesn't worsen, because that's turning into a more serious issue. So the most common reason is eye strain. Many of us are staring at small screens all day long, or computer screens. College and grad students, computer scientists, or people working on computers all day are really particularly susceptible to this. It's important to take a few breaks for even just a few minutes every hour to look away from the screen to relax your eyes and the muscles around them. There is some thought that intense chronic stress can also cause eye twitching as well, but usually there is some strain in the eye region to begin with, which is why sometimes I think of grad students or college students stressed and studying all the time and staring at screens. It all adds up, and then the tension turns into eyelid twitching. Sleep deprivation and severe fatigue can lead to eyelid twitching as well. Dry eyes and allergies affecting the eyes can be a risk factor. In this case, preservative-free artificial tears can sometimes help. You may not think of this one, but heavy alcohol use can reduce the number of minerals in the body, which can also affect the eyelid. Poor diet, low in vegetables and fruits that have minerals like magnesium can also increase risk of eyelid twitching. Environmental toxins like air pollution and also intense artificial lights can increase risk of eyelid twitching as well, in which case I recommend using just dimmer, calmer lights at night. Eyelid inflammation, now this can be from infection or chemical reactions to cosmetics and skincare products, can also cause this. A couple of tips here. Reduce caffeine intake to just a cup in the morning. Have a diet high in avocados, leafy greens, nuts and seeds, fruits and veggies, and also consider increasing electrolytes. Electrolytes mean small amounts of calcium, magnesium, sodium, and potassium. And this can be put in water in a tablet form or a powder packet. Coconut water is a great way to get electrolytes. Also get your magnesium level checked. Sleep more, look away from the screen every 20 minutes to relax your eyes and focus on something in the distance. And then one other suggestion is to control allergies in dry eyes. Many people holistically use something called quercetin, which can reduce histamine levels and reduce eye irritation. Last but not least, consider trying out something relaxing like yoga or breathing or meditation to calm your nervous system and get in your body. Now, omega-3s aren't directly linked to eyelid twitching, but omega-3s are really important for the eye. And you can get these from sardines and anchovies, but also plant sources like chia, hemp, flax, walnuts, and some algae. Lastly, try to pay attention to when this is happening. You can keep a log, and then I think very quickly you're going to figure out what it is that seems to be setting off the irritation and the eyelid twitching. This is Dr. Ashley. Thank you so much for joining. I hope for those out there with eyelid twitching, this has been informative and helped relieve a little bit of stress about this topic. Let me know if you have questions. Please subscribe and join me for another episode soon. Thank you.